There it is. Okay, now you should go ahead. Sorry about that.
Okay. Doc, you want me to go ahead and start, or what works best?
It's completely up to you.
Okay, well, I'll go ahead and hit this definition real quick, and we can just get on with it. Peace and greetings, everybody. First, let me thank everyone for bringing myself, and I am humbled to be in the presence and on a panel with one of my mentors and sheroes in this work that we call justice work. And I humbly present to you all some things that I think are important to you all in the medical community. And I think, and I actually, again, I appreciate the Chicago Health Coalition for Black Lives, because I am usually used to being uninvited to stuff. So anytime that I get an invite, it is always a good thing for folks. And if I don't see you all ever again, I know what it is, right? So what we wanted to do today is talk about a couple of things. And I think what's important is to get into understanding something that a couple of misconceptions that we have around violence and racism, right? So violence usually is positioned as an interpersonal act, right? So, or an act between groups. Rarely do we actually begin, and now that we've seen, and now we're in this current moment of racial reckoning, racial unrest, and a global health pandemic, now we're starting to see more people engage a conversation about violence as structural. And when we talk about violence, we're talking about any actions or results of policies that harm a particular person or group. Now, when we talk about structural violence, we're talking about the ways in which structures have actually harmed groups historically and in the contemporary moment. So when we think about something being structurally violent, what we need to consider is how something has affected a particular group and has resulted in that group's detriment. And one of the easiest ways that we can actually think about this is in terms of structural violence in terms of the health community. So when we think about who has been denied health or healthcare, or who has been wrongly experimented on, we're just hearing about what's happening in some of the ICE detention centers where Latinx women have been given unsanctioned hysterectomies, right? And what is the rationale for giving these women these hysterectomies? And ironically, a history of sterilization of women of color in the Western Hemisphere by white imperial and colonial powers, right? So I think when we talk about structural violence, it's important for us to understand that we're no longer talking about individualized acts, but we're talking about the ways in which systems enact harm on particular people. I'll stop there, Doc, and pass it on over to you.
Thank you. I think that's an excellent definition. And I'm going to, because I want to keep within our culture, it was decided I would make a brief PowerPoint. I'm going to go through these very quickly, and you will be able to get them from the organizers after this meeting. I'm only going to talk about a few of these slides. First, let me suggest to you, all of you, many of you are students and health sector professional students. Brother Malcolm's quote, "Thinking is dangerous," is really true. And what we have to do these days is really begin to think very carefully. And Dr. Stovall has laid out the definition of structural violence. We are really talking about violence at a population level. I wanted to put this, I'm not going to read Aridana's Roy's quote, but I just want to say that we are in the midst of we're not in the midst, we're at the beginning of a global pandemic. That pandemic is going to loosen the whole pillars that are holding up the United States. We will see more and more bad outcomes from this, but this is also an opportunity for us to question the foundations on which this country was built and to fight to change them. This is Nancy Krieger's model of eco-social health. I'm not going to bore you with the topic on it, but as health professionals, we always have an idea, a theory, a framework that helps explain why some people are healthy and other people are sick. And so this type of model, this family of models, I happen to like Nancy's, is there. And in that sense, then, people and neighborhoods, communities, nations are made healthy by what's on this graph. What do we do about racism? What do we do about gender discrimination? What do we do with different classes of people? Or they're made ill by that. This is her view of racism. Oh, I wanted to say this is a commercial. If you have a chance to go to Montgomery and check out the Legacy Museum, you should definitely do that. Look at this later, after this. These are some of the structural things that determine why some people in this country are healthier than others. Things like making the decision to give land to colonialists, things like the 1830 Indian Removal Act. So we don't have time to go through all that history, but they may not be directly related to medical policy. I want to just give a few clinical examples, just so you know that this is in our lane. This happens to be maternal mortality in European country, our peer countries, as you can see. And the United States, our maternal mortality is going up. That's bad, in an opposite direction from where it should be going. It's been going that way for decades. It's not going up evenly. So you can see here on the right that maternal mortality varies by racial group and ethnicity group. And if we did data by class, which we don't do, it would also exist there. So when we talk about structural violence, this is what leaps into my mind in this past few months. How we've created an economic system that forces our essential workers to work often for below minimum wage is part of structural violence. So we'll skip that. You can look at that later. I wanted to just end this little piece to remind you, if I think about the violence that's been committed against Black people in this country, and if I think about the violence that's been committed against other groups of color, I don't think first about what the police do, because what they do is like the tip of the iceberg. This is just a summary of the 15 leading causes of death, but this is an interesting look historically. In the past century, these authors, Jackman and all, have really argued that about 7.8 million African Americans died that should not have died. In other words, if our death rate had been the same as white Americans, fewer of us would have died. And that's almost close to 8 million. So this is just a graph showing by those years, these excess deaths. The excess deaths vary by males and females. This is a major problem. So when you talk to me about structural violence, I can see in every facet of life, people dying early, people suffering more. That's the nature of violence. And in our country, that violence is racialized. There are persistent differences in health status by race and class. Hopefully most of you know that. And even though class is an important factor, in our country, it is always racialized. And so if we're going to improve health inequities, we have to look at the structural conditions of our society. Racism is critical to understanding structural violence. We can't address structural racism without addressing violence. Racism is a system that unfairly disadvantages some people and unfairly advantages other people. And that unfairly advantage we have to pay attention to. I don't in any way mean to demean the special role anti-Black racism plays in the world, and certainly in our country. We occupy the lowest rank in this hierarchy, but racism is not binary. It's not simply Black and white. And the rankings of people of color change from time to time, and also the ranking of who is white changes over historical time. This is from about number of deaths. This is another way to think about it. How many people die because of low education? How many people die because of racial segregation? How many people die because of income inequality? These are the kinds of differences that we need to pay attention to. You all hopefully have seen this. If not, this is a WHO model, very consistent with the first model, an eco-social model. And there on the left, what kind of government do we have? In my mind, the Electoral College has done more structural violence to our people than any other single thing that I can think of off the top of my head in terms of present day structures. But what are our economic policies? What are our minimum wages? Do we have a minimum income? What are our housing policies? Why is it in the United States you have to pay to occupy space? That's what it means when we have people that are unhoused. It means that we think you have to pay money to occupy space. An absurd notion, I would argue. So I'm not going to spend time here. I think we know what we have to do to improve things. I want to stop just at one area, which is right here. You all are going into healthcare. This is a minor reform. If we're serious about dealing with this pandemic, in the first 100 days of a new administration, we should be passing single payer. That's what should happen. I want to end up just with these slides because I want to be clear. I turned 18 in Cleveland, Ohio in 1966. I had just graduated from high school and I was on my way to Chicago to go to college. And in 1966, there was, as there always is, every year, every summer, every month in this country, police brutality and murder of Black people. And so in 1966, when I was coming out of high school, we had major demonstrations against police brutality, an incident that occurred in Huff, a neighborhood in Cleveland. That's more than 50 years ago. This is 111th Street in Mount Greenwood on June 4th. This is the reaction that went on all across the country. It's one of the reasons that you all are gathered here tonight in response to George Floyd. Just the latest of hundreds and thousands of Black people and other people of color murdered by representatives of the state, by capitalism, by racism. And what really infuriates me is laying down there on the pavement, that young Black woman that's there is my 18-year-old granddaughter who's in the streets more than a half a century later protesting the same goddamn things that I did when I was 18 and on my way to college. You have no idea the amount of rage that causes me to go through. So I want to end the same way I started, except this time with a quote from Dr. King. Rarely do we find men who are willing to engage in hard, solid thinking. There's an almost universal quest for easy answers and half-baked solutions. Nothing pains some people more than having to think. I would suggest to you that the problem we have here is not a school to prison pipeline, but a state, a carceral state in general for people of color in this country. School is very much like prison. And for most of us, and especially nowadays, there's very little difference between education, what passes for education, and what goes on in our prison systems. So as we, in our relative position of privilege, as we think about what we can do to improve the health of the communities in which we live, the health of people we're privileged to work with, we have to think more deeply than simply the latest video. We have to understand that there's a reason that those videos take place, that information, those murders have always taken place. And we have to be willing to examine the pillars that hold up the country: capitalism, discrimination based on gender, and discrimination based on race and ethnicity. When we begin to grapple with those real problems, then we have some hope of actually stopping and undermining structural violence. So let me stop there, and hopefully we can engage in some discussions back and forth.
I'm just continuing, and I'll be very brief in terms of giving an example of what Dr. Murray put forward. And thank you for that, Dr. Murray. And I think it's important to reiterate, we are not talking about existing under one pandemic. We are talking about existing under three, right? The global health pandemic of COVID, white supremacy, and capitalism. Space around talking about something like education. I think, and can we go to that slide around the Nexus? There we go. Thank you so much. So when we actually talk about this, I think there's a couple of things to consider. One of the sites of structural violence is the schooling system. Now, I want to be clear to make a delineation between schooling and education, right? Schooling are the rules and compliance that you are falsely rewarded for as you demonstrate your proximity to whiteness, right? And again, that gets me in trouble a lot, but much of school is probably bad for your health, right? So this idea of sitting down all the time, being in a space where movement is limited, and a place where you're in often cases fed bad food, right? So if we think about that in some cases, and again, I'm talking about schools in spaces that have been historically disinvested from, schools in places that have been historically underfunded, schools in places that have never been deemed a priority. I'm talking about schools where the young people in there are thought of as disposable before they are thought of as valuable. Here in Chicago, we have 120 schools that do not have libraries. And all of those schools are K-8 schools. So if we begin to think about that, what does it mean to have a group of young people exist under these conditions? And what does it mean for their health outcomes? And how can we see it as a determination of the city to declare them disposable? And I'll give you all an example of this. So over the last couple of years, I've been teaching in a place called Statesville Prison, which is in a place called Crest Hill, Illinois. That's right outside of Joliet. And when you walk into Statesville, there is, once you go through the metal detectors and a couple of large doors, there's a yellow line down the middle of the hallway. And right above the yellow line, it says, please step to the right. And what that's called is a passing lane. So if there's something that happens, if you step to the right, then the corrections officers can address whatever is happening in that passing lane. And I'm walking through and I see this. 2 weeks later, I walk into a school, a K-8 school, not a high school, but a school that serves kindergartners through 8th graders. And I see the same yellow line. I see the same signage of please step to the right. I see a group of young folks who are required to walk with their hands behind their back or folded in front, and they're wearing uniforms. So if we, and many of you will have seen this language of the school to prison pipeline, meaning that the school is the place that is preparing you for some existence in prison. And I think we live in that experience that I just gave you all. I think that puts us in a deeper situation where school in many cases is not this pathway to prison, but in many instances, depending on where you go to school, the school and the prison, because of the logics that they use, are the same thing. You are in prison, not necessarily in school, and you are treated like a captive. So now if I start to think about this and what this means long-term to your health, then those health outcomes are connected to this structural violence that has deemed you disposable before you have been deemed valuable. And I think this becomes an important space because in many instances, we don't ask deeper questions of the school and its function, right? And this is no slight to educators in the building. This is no slight to the young folks in the building. What we're talking about is people who have been put in conditions to suffer through in opposed to thriving in. And when we think about that particular relationship, now we have to turn to our critical questions to say, if we know this is real, then what are we willing to do to interrupt that? And many times in the medical community, people think about you all as being separate from this. And I think about you all as being deeply connected to this because you all will see this grouping of young folks and families who have had these experiences, and you rarely get a chance to ask about the source of their illness. You get to engage and figure out what it means to be in a space with lead-based paint, leaky water, rusty water, and non-nutritious food. And then we ask the question around what is wrong with those people who are living under these conditions, in opposed to asking the question, what is the issue with these conditions? And as a health professional, if I do not ask questions that allow me to identify these conditions, then I have the capacity to further exacerbate the problem. And I think this becomes important when we familiarize ourselves with these realities. So this school and prison nexus is really understanding that structural violence says that these are the same places, that they're not necessarily places that people get educated, but it's where people learn the rules of racism and white supremacy and are forced to comply. And when they reject those rules, they are thusly blamed. And I think this becomes important because as you all ask these questions, we are now understanding education to be a public health concern. And as education has always been a public health concern, now we have to think about what are the ways that we can support folks in these spaces, knowing this to be real and true. And again, I'm talking about a certain segment of the population. We have schools that are thriving, that are well-funded, that young people are able to explore and ask questions. But we also have many schools where young people are not allowed, where they are disallowed and they are isolated and they are contained, just like in a prison. And I think when we put these realities to the fold, it allows us to move and do our work differently. Can I check and see if there's another slide? I want to make sure, and this is time. So yeah, let's go ahead in here and then we can just go ahead with the question and answer session because that's much more fruitful. So thank you all again for engaging.
And as you all think of your questions, let me just suggest that there's also a profound difference between training and education. So this audience, you all are among the best trained people in the country. Very few Americans have more training than you all, more years of successfully negotiating our education system. That doesn't particularly mean that you're educated. It just means you're well trained. And so again, I would argue that our curriculum, both in our schools of public health, our nursing schools, our medical schools, our PA schools in general, do not teach you what you need to know. They do not talk about in any kind of serious way what makes people healthy and what makes people ill. So that's part of the challenge that you're faced with. Do we need educated physicians and PAs and nurses, or do we just want technocrats that are going to check the boxes and practice medicine by formula? So I'm looking in the chat to see if there are questions. I think you can unmute yourselves. I'm not sure. I'm not in control of this, but
I see a question here by Vikrant. Can we speak a little to the similarities and parallels when they say schools act as prisons? So one of the things that we think about in this way, and here in Chicago, there's a very unique relationship. So until 2005, you could be arrested and processed in a high school, right? So if there was any infraction, the police could actually come into the school and arrest you and process you. There was actually a police computer that would actually be in the school. So when we talk about the school prison nexus, many of these places are ones where you don't have to go to central booking. You can be arrested and processed in a school and go straight to a holding cell, right? And another thing that comes into mind is that when you look historically and even in the contemporary moment in terms of architects of prisons and schools, often they're the same people, right? So we can actually see that the manufacturing of schools by large architectural firms, they use similar designs for schools and prisons, right? So this thing around putting this nexus, this understanding of a nexus together, I think becomes critically important because they are not necessarily dissimilar depending on the young people who are in that building. They can, in many cases, be considered the same thing, all the way down to the ways that they are constructed.
So I see a number of questions asking more specifically about metal detectors in schools, et cetera. Again, the role of that yellow line in prisons and the role of the yellow line in that high school was the same. If you think the role of schools is simply to teach you how to stay in your lanes, if you're going to be a good bricklayer, that's what they want you to do, lay bricks, that's it. If they don't think you have the ability to be a bricklayer, then they have you lined up for other things. So the question is, what does real education mean? Schools, the reflection of metal detectors in schools reflects what's going on outside the schools. And that's why, to the extent that some communities think they're useful, that's why they're there. If you encourage a community to become unsafe, if you encourage interpersonal violence, if you make it so people cannot function and live without engaging in that, then you create the conditions where people have to act. If you treat people like animals long enough, then you create the conditions where they have no choice but to engage in that kind of interpersonal violence. And people that live in communities like on the south and west side of Chicago, many places in our city, they're aware of that. And so you find many people who falsely think that a metal detector in their child's school is going to somehow make it safer. It doesn't. There's no evidence that it does. And again, I think while it's important to look at those examples, 60% of our kids here in Chicago are, or maybe even more than that, are in conditions that are just like prisons. But I want to also remind you that just because you have a fancy lab and a good swimming pool in your local high school, that doesn't mean real education is going on there. It's a different kind of education that's going on in many of our Chicago public schools. And based on what? Based on a value of what we think those children are worth. So if you think that Black children are not worth anything, if you think a new Honduran immigrant is not worth anything, you're not willing to invest in educating that child. And more importantly, and this to me is the big secret because you all have gotten training, if you don't want the populace to be educated, if you want to be able to manipulate them and convince them that COVID-19 is a threat from China, then you don't want your population to be educated. So when we fight for a real education system, we're fighting for not simply improving the conditions of Chicago public schools or our rural schools. We're fighting for real education where children are treated as human beings and where there's some thought that people can mature and grow up and be thoughtful and questioning and challenging to the system. So I want to make a tie because it's just like in healthcare. It's not like everybody's healthy and then there's a cliff. No, that's not true. Everybody in this country is not educated and then there's a cliff. The lack of education goes in a stair-step way. So you may go to Harvard and you still may not be educated. Okay, you may have more training than someone who isn't allowed to finish high school. So I think that's an important distinction when we're talking about how do we support a democracy and how do we create social change in this country.
And I'm going to pair Jonavi and Vikrant's question in terms of the current COVID moment in schools, and then how principals and teachers can be sacrosanct in the policing of Black and brown bodies. And it's important that pre-COVID in Chicago public schools, 60% of young people enrolled in Chicago public schools access the internet via phone. Post-COVID, from March to the end of the school year in June, 60% of all CPS students never logged in, right? So we have to put that into context. What does that mean? Because that's not a question of will as it is a question of access. And when we talk about structural violence, we need to think about who has been systemically denied access to the things that they need, right? And then how can teachers and principals, if they are not careful, be complicit in this? And I'll give you all an example of this. We have instances now where Black and brown children are being kicked out of class via computer. Now, excuse my language, but how in the whole fuck are you kicking me out of a class when I am in my own house? What sense does that make? Right? And then you all just saw 2 weeks ago, young person had a toy gun in his house, and the police were called and arrested him in his own house. Right? So now if we think about this carceral state, or this idea of who should be contained and how all things are situated around your containment, look no further than the ways that many Black and brown youth are treated in schools. So I think it's important for us to pair these things in its absurdity, but also to know what it's connected to. Because when we take into account what it's connected to, then those logics allow us to see that all of this is about order and compliance. And what Doc Murray just put forward is education is the breaking of the system of order and compliance. And again, your training tells you never to do that. But if we ask critical questions, now we begin to think about what we can actually do. And Anita, your question around one of the best ways to educate yourself is to always be asking the question. And one of the questions that I'm always asking in terms of what I'm hearing and what I'm doing and what I'm seeing is, what does this mean for the people that I care about? Right? And the question sounds simplistic, but I think when we ask that question of relevance, we can now begin to dismiss the things that would distract us and go deeper into the issues and concerns that we see as tangible and connected to our lives.
Someone's asking a question about the police in the schools and the confusing summer. Some schools, voted to get rid of the police in the schools. Other schools in Black and brown communities voted to keep them. And again, it's important that we break out of what we think is possible. So if your fear is that the chaos and danger that your child may be under in the general public will come into the schools, the danger's still there, then you falsely think police can protect you. But we know that the role of police is very different. The role of police is to keep order. That's the role of the police. And so what you really need is people that are willing to create some disorder in order to improve things. But I think we can say we have had a lot of good experience setting up institutions, schools that allow children and help children ask those dangerous questions that Dr. Stovall is talking about. That's exactly what Malcolm X and Dr. King were talking about in the slides I presented. You have to be willing to ask those dangerous questions. That's even more important than agreeing on the answers. First, you have to be willing to ask the questions and say, we don't have to have the choices of lock up the kids with metal detectors or don't have school. That's not the choice. So I think that the critical thing in terms of this particular situation is how the carceral state, that is to say our prisons, I would argue nursing homes are carceral in nature, in large measure. As I get older, I'm more worried about that than I may be about 26th Street. How you have to dress professionally. If I could tell you how many medical students or nursing students take a job and are accosted because of their hairstyle or their dress because it's not professional, that doesn't cost you your life in the way you can be killed by the police on the street. But again, to me, we have a situation where we have a country that is not free. And to the extent that we're able to draw dots between those that are actually behind bars and those that think that they're not behind bars, that's an important lesson. It's a question, when I worked in the jail, was just like, the only question is which side of the wall that you're on, but we're all in this place together. And in large measure, I think that's really true for huge portions of our population, certainly the Black community.
And I'm gonna go here to Elise's question around educational opportunities in prisons in relationship to this idea of schools acting as prisons. And there's a critical question that I ask, right? We know that there's this difference between schooling and education. Schooling is the order and compliance. Education is the capacity to ask those questions to interrupt that order and compliance. And the question that I always ask, and as someone who teaches in prisons, I always ask this question is, can schools be the place where education happens, right? And not as just this polemic question, but literally a question saying, can we engage these radical imaginaries in these places that have never been designed to do so? And my answer to that is yes, right? And we have to do that fugitively, right? We have to do that intentionally, but say we must always know that that type of sentiment will never be in compliance with the order of white supremacy. In fact, it runs counter to it. So it's never about, if you are in a schoolhouse, if you are teaching in a prison, you're teaching in a schoolhouse, and you are engaging in radical imaginaries and engaging from critical perspectives, it is never about if the authorities will come for you. It is always around understanding when they will come for you and that you should expect them, right? Gauge that and not be fearful of that, right? Because I feel like the historical record and the data is actually on our side. Order and compliance doesn't want you to engage it, right? They want to give you falsities about it being fake news. And I think important in terms of thinking about those opportunities to engage. If we can engage in that critical perspective, if we can engage in a way that has people ask questions of their reality while working to change them, then those spaces can happen in the schoolhouse. But we have to be very intentional about us making sure that they happen. And then this question about schooling in its relationship to capitalism. There's a unique pathway, right? Because usually school was a place that was preparing people in the order and compliance to work, right? It was preparing you for work. But now, if we think about market-based financialized capital, schooling has taken on yet another component, right? So now schooling is thought of, ironically, like prisons 15 years ago, as big business. So now you have all these venture capitalists who are using charter management organizations to sell schools to districts at a cheaper cost than what it would take to engage in a public education system. So now we have these market-based realities when we talk about schools, and look no further than the city of New Orleans. Currently in New Orleans, there are 7 traditional public schools left in the city. The remaining 60 plus schools have all been charterized, right? By these venture capitalists who have charter management organizations who sold their services to the state of New Orleans, right? And there have been attempts to do this in Houston, Miami, and then even here in Chicago where we reside. So I think it's important to put that mix in where school used to be the place that prepared you for work, but now under financialized capital, it's been now viewed as a place that has been set as a money-making opportunity. So this is where late-stage capitalism has actually kicked up how schools are used in relationship to capitalism.
And let me just point out here the obvious parallel with the healthcare sector. So it's not an accident that here we are in COVID, in the early stages of a global pandemic, and every major hospital in our city is laying off staff. It's not an accident that UIC nurses and the service workers are out on strike. So we have a medical care system very different than most of the world, where it is a market-based system where the goal is to maximize your profits. So Mercy Hospital, the oldest hospital in the city of Chicago, by the way, is closing, not because there's not a need, not because they didn't do good work, but because they can't survive in our present market's atmosphere. And in the next 12 to 18 months, we'll see another half dozen hospitals in our city and near suburbs close. So you're entering a field which has thrown out any vestiges of what we ought to be about. How do you keep people healthy? How do you work with communities to stay healthy? And the only question that's asked and has been asked in American medicine for many decades is, how do I maximize my profits? Even when that results in causing pain and suffering to patients that we're supposed to take care of. So that's why we have a medical care system that is horrible. It's not the best in the world by any chance. It's among the worst among industrialized countries. So this is an underlying philosophy of capitalism gone to its logical conclusion. No, you can't educate anyone in a capitalist system because the goal is not to have anyone educated. You may need some people highly trained so that they can do neurosurgery, but that's not the same as being highly educated so they can be questioning and challenging of what's going on in the world around them. So one question is, in this particular session and the other sessions you all have organized are part of that. You clearly have recognized as a group that there's something missing in your education, and you're trying to put it in there. That's to be congratulated, but understand that that's a very deep and long-standing process.
And just Vikrant put this request out for capitalism. When we talk about capitalism, what we're talking about is the production and distribution of goods and services and the control of the means of production of those goods and services. I think that becomes important because a lot of times people just think about capitalism as making money, but money, remember, is just the tender by which to demarcate the production and distribution of goods and services, right? So when you have a dollar bill, you see on it, this is legal tender, right? It is legal tender for you to actually purchase those goods and services that are controlled by the wealthy and large groups and actually are limited for folks who do not have access to that legal tender, which we now refer to as money. And I think that a lot of times, thank you for that, Vikrant, because a lot of times folks think about it and then we automatically go into Marxism, but we don't take into account the basic spaces and principles of capitalism. There was one thing here that I wanted to address again around, so we think about school spaces, people talk about restorative justice, and there are many folks in the transformative justice community who are saying restorative justice has a problem, right? We need to ask, what are we restoring folks to, right? If you're in a shitty situation and now harm has been done while you're in that shitty situation, I don't need to restore you back to that shitty situation. We need to take into full account that situation. And now the transformative work is to shift that situation. And I think that's a much more holistic practice than to say, okay, now everybody go to your peace circle. Now it becomes just form, it comes pro forma, and it's not centered around healing, which is recognition of the harm and the work being done to reduce harm in the future and to address current harm. And I think that's a very different approach when we talk about restorative versus a transformative justice.
And so there was an earlier question that was related to that, which asked about, could you really do a different way of doing justice if you had the power structure of the school remain what it was? And clearly I think that's a problem. And in fact, this whole discussion we're having, these things don't happen like a light switch. So, you know, at some point your training has to kick in. We want all of you, for example, to finish your education because we think you could be more useful as a skilled PA or a nurse or whatever education you're pursuing. But the point is, in the process of doing that, if you have a critical approach to it, if you're asking the questions, if you're reaching out to other people, if you're making alliances within your field and across your fields, then you have a better chance of building power. So power doesn't just come from the sky; it has to be built and nourished. And so part of the process of doing that is asking questions together and trying to change small things. You may not make all the changes you want in the beginning. So certainly if you're a high school teacher and you want to put in a different approach to discipline than just expelling a kid, I think that's a good thing to do, but understand that you have to always address the real powers of the country. And you have to have a common understanding of what those are. And that process, people call it organizing, you can call it whatever you want. That's a process where you actually are building community, building a common set of values, building power so that you can have some impact on what's going to happen in the future.
To just ask a question that's more clarifying, I feel like I have a good understanding of this, but I think we should all make shared meaning. When you talk about power, and you've used power in two different contexts, can you differentiate power that is built by organizing with people against the state, against the system, whatever that looks like, versus power that is like given/ascribed via hegemony? Like, can you differentiate those two things for folks on the call?
No, because I don't think there's a difference. Let me
Okay.
be really clear.
Yeah.
The power that exists today among the people that have it didn't come from God or the rule, it didn't come from the sky. They built that power up over centuries. And so I think that's important, because if you think they get their power from some divine authority, even if you don't use that actual concept, you're putting yourself in a bad situation. I think power comes the same way for all groups, and so they organize. And if you read carefully, I must admit, when I was younger, I did not spend a lot of time reading what the right wing was doing. I've learned that was a mistake. But if you look carefully, there are many historians, of which I am not a historian, that argue that really the roots of the present sort of power concept that we have today, with their ideology that's sort of a neo-fascist ideology, market-based, it started in World War I. They trace it all the way back to debates that they were having in World War I. So I think that communities have arguments over what their values are going to be, or what they think is important, and they build power by banding together. Now, you can't ignore history. So if you spent 400 years in slavery or 300 years in slavery, that you can't really overcome that immediately, instantly. But power, I think, is built the same way. I don't think there's a difference between power that you get by organizing oppressed people and the power that the ruling class has. They weren't always the ruling class. History goes back a long way, and they built power that same way, by organizing, by consolidating, and by controlling critical things. So if you control the education system, you control the means of production. As a Marxist, that's my go-to concept. So who controls that? Well, it depends on how you think about it. I think you can argue that when workers understand that they really control the means of production, then you have some hope of making some progress. And this time, these pandemics, historically, we've seen progress made. Not always positive progress, but frequently positive progress made, because the pillars of the existing power structure begins to crumble. And so this is an opportunity for us to insist, no, it's not acceptable that people starve in this country because we have a pandemic. That's not acceptable. We need a minimum income. It's not acceptable that people not have access to medical care. So there are demands that we can make today that more people in our country will think are reasonable, that we would have had difficulty convincing as many people 5 years ago, for example.
Yeah, and I think back to Doc Murray's point, what we're really talking about is the way that power is used, right? I mean, it's really us putting into context the way that power is used, right? It can be used to uplift, and it can be used to suppress and oppress.
And I also want to make a comment, just because I don't know what your undergraduates were, but neither Dave nor I am economy. Every area you have huge healthy, hopefully, arguments going on about what things mean. And how is capitalism developed and what is it today? So I would be bad as a good Marxist if I acted as though we had a simple definition. There are lots of debates. The system has changed and morphed, how capitalism functions in this country is different than how capitalism may function in Norway. So even within a capitalist framework, you have lots of room for different kinds of policies and approaches. How Finland approaches education, their K through 12 education, is profoundly different than how the United States approaches K through 12 education, even though both countries are capitalist countries.
And then there's a question here from Taylor around what does structural restorative justice look like, and are there examples of spaces like that? We have larger examples like the city of San Diego, which has its problems, especially in terms of white supremacy in the form of immigration in the form of ICE and what happens to brown residents in San Diego. But there actually is a movement of people in San Diego that have taken the idea of school resource officers and dismissed that, and actually have began a restorative or transformative justice program under a woman named Michelle Ferrer, who's doing that citywide in the city of San Diego. Last week, there was a report issued that there are now 10 large cities in the United States that have removed all police officers and all school resource officers in their public schools. So these are starting points, definitely not solutions, but these are starting points to think about how our world can be reimagined if schools and if education is thought of as folks being able to contribute to the society while not harming anyone. And that's interesting. I appreciate Doc Murray's point about Finland, because that's Finland's understanding of the education system, right? They see their education system as preparing a group of folks to contribute to the broader society, in opposed to working for some rich capitalists, right? And that's a very different approach in terms of how you engage what happens in schools. So think about here in the United States, we have something called the Individualized Education Plan, but you have to qualify, quote unquote, to actually get that attention in schools. In Finland, every student has an individualized education program. Every teacher knows what's happening with their students because it is mandated that you cannot have a class over 25 students. Every teacher who is trained in Finland does not get their own classroom until their third year of teaching. Right? So if we think about these particular practices, now we have these tangible examples. And I think now pulling from these tangible examples now allow us to reimagine a system that is transformative, or ways to do our work that is transformative.
There's a question here about referring to Mercy Hospital closing and other ideas about how to address inequities, both not only in health, but in education, and how we fund it. So again, this is the first minor reform I would do. Any law that said we have to have a balanced budget should be thrown out the window. I mean, we shouldn't even allow that, especially during this time period. So why would you have a balanced budget when we have a global pandemic? It makes no sense. But more importantly, why do we have a structure that funds our common good built on the backs of working people? We don't I mean, this is going to sound trite, but it's true. We should tax the motherfuckers with the money. They say that Bezos has made more profits since COVID started, on top of what he usually makes, enough to fund a whole bunch of stuff. That's just not acceptable. We should not accept the notion that some small portion of the world's population should get most of the wealth. And that wealth inequality, as well as income inequality, has grown over my lifetime. And especially in the past 15 or 20 years, it's grown and it's gotten worse, but that can be stopped. There's no reason we have to accept that. One of our problems in this country is we are trained to believe there's no way to fund it. There's plenty of money in this country, and there's more than enough money to fund public education if we thought public education was important. But to answer your question bluntly, it means if you want money, like what is that old cowboy thing? If you want money, you have to go where it is. So the money is not just in the banks, but it's in the people that are running our system. We need to take the money. We need to have a different tax structure and take the money and use it for the common good.
And Vikrant, this idea of the culture of teach-ins brought about by students is subversive to school systems, and then the Black Panther Freedom Schools and Freedom Schools today. I mean, the idea of a freedom school and this practice now, I would argue, is a practice of fugitivity, right? That you know something is wrong, but you have made a decision to run. Now, the important distinction here, you are not running from something, but you are running to something. And I think when we actually start to engage that, when we start to talk about where we are running to and who we are running with, then that makes for more fugitive space, right? So myself and Doc Murray are part of a network of people who do this work. Definitely not large enough, but we have a grouping of people that we've been able to lean on over the years when things have gotten tough for us. And that particular fugitivity has allowed for us to have the space to keep our criticality and to remind us of it in all the places that we operate, right? And it's not these things that people think about as, you know, these pie in the sky things, right? These are very fact-based, simplistic measures that we can actually engage. So for example, you know, the graduated income tax here in Illinois, right? If no one knows who Ken Griffith is, he's an important person to know in Illinois. Ken Griffith is the richest person in Illinois. He has a net worth of $14 billion. Ken Griffith spent $26 million of his own money to oppose the graduated income tax. Now, strange thing, we also have a billionaire governor. We forget that about Pritzker, right? Pritzker himself is a billionaire. He spent $56 million of his own money to support a graduated income tax, right? And all a graduated income tax means is that the more money you make, the more you get taxed, which is how it should be. So this idea, but now we have to deal with that kind of contradiction that two billionaires are having a pissing match against each other. And then, but at one end, you could get a situation where you're paying less if you make less, right? Which is how it should always be. But I think we always have to wrestle with those contradictions. But at the same time, putting that in context, right? And this moment is now not just reminding us of the absurdity, but also saying that a lot of these things are very practical, right? And then for those of us who have been long-term residents of Illinois, I remember a governor by the name of Jim Edgar in the 90s. He said in the early 2000s, he said, look, you know, I told folks in the early 90s that we hadn't paid taxes in Illinois in 20 years. It's 20 years later. So a $15 to $40 billion deficit makes a lot of sense, right? So now if we think about these, and this is financialized capital. These are monies that are based in bonds that are spent long-term for particular things or not spent, right? So I think for us to really understand what this COVID moment has shown us is the frailty of capitalism, right? And really what it means to use those resources to address the issues and concerns that have been noted by those who have been historically exploited and marginalized.
And all of you that are registered to vote in Illinois will have a chance to vote on whether you're going to support JB or Ken. But let me just say this, the critical question to ask is, why is our basic revenues based on personal income? Because if you understand rich people, most of their money doesn't come from income. Okay, so when we're fighting over pennies here. That's what we're really doing. the rich people in this country get their money from dividend returns and capital accumulation and all kinds of other things that are not part of personal income. Only relatively poor people like us actually have a certain amount of income and have to pay taxes on that. So this fair tax that I'm going to vote to support, because it's an improvement, but it's not going to solve the problem. It doesn't really do the kind of corporate taxing that we should be doing. It doesn't really address how much profit they're allowed. If they were forced to pay workers more, for example, that would decrease some of their profits right there. Why should you work in this country 40 hours a week? Well, actually, I think full-time work should be 30 hours a week, but why should you work a full-time job and still be in poverty? There's no sense to that. But if you're not willing to ask those questions and accept the notion that there might be a different way to do things, then we're stuck with solutions that our enemies give us, and we don't have enough critical discussion about what's wrong with those solutions and what are some alternative solutions. So these ideas, like was mentioned in the chat about the freedom schools, etc., those are always good places. They allow people to flesh out and try out different approaches, like the high school in Little Village. That's a result of social struggle. That's why that school was built. But what we need is something that we can apply across the whole nation and across the whole world. We haven't talked very much about global incidents, or we haven't talked about the real crisis we have in this country with the Western coast on fire. And that's going to continue to happen. We haven't talked about the connection of these problems with climate change and what answers do we have to address that? Or if we get a vaccine, how are we going to distribute the vaccine? So unfortunately, these problems, which I would argue have the same root cause, are bubbling up and coming together because they are connected. And we are going to be at critical tipping points in human history very shortly when we ask ourselves, what are we doing with the planet? How can we recover as a species on the planet? And if we look at history, movements come together in waves. It's not an accident that Earth Day happened in the same era that we had the modern civil rights movement, in the same era as we had the modern feminist movement. When people are in motion, then they communicate, they struggle, and they are able to make some progress.
And Genevieve, this idea around a more nationalized education system would begin addressing some of the inequities. In this current moment, I would say no, because any system to nationalize an education system often prioritizes patriotism to it. And I think that's an important piece around the patriotism now promotes this false narrative, right? And I think when we talk about a nationalized system, we have to take into account that the false narrative that gets into this kind of idea of American ideals would be centralized. And that is a problem. I think we can distribute more funds to local school systems, but a national system in this current space would not allow for the type of criticality that we're talking about. But there should definitely be more resources to education, but my concern with that national space is always trying to tell a national story that instantaneously excludes. So I think that that's always important to put into context.
We've been talking about K through 12 education. I just want to bring up a note that this pandemic may actually see a significant percentage of our college, of our four-year college base disappear. These colleges are in major financial trouble. And I expect over the next 5, 6, 7 years to see whole numbers of them close, especially the smaller liberal arts colleges. And we see an argument for that already, saying we don't need these liberal arts colleges. We need to just train people how to, program this computer, or be this kind of welder, or be this kind of physician. So they really are trying to push just for the technocratic skills that the system needs to run. So the entire society is being under pressure. This is how I look at it. There's an old saying that when America gets a cold, the Black community gets pneumonia, which has obvious meanings. Well, let me tell you, now America has pneumonia. So we're in big trouble. That's why we're on ventilators. But the country has pneumonia now, and there's not a space that we can talk about that is not impacted by that. And if you really dig deep, you find that the reason we ran out of toilet paper, because we have two different ways of producing toilet paper in this country. One for the commercial sources and one for residential. And they can't easily switch because of how we've set up the market to do that. So when people stopped being in the offices and in restaurants and going to work, and they were at home shitting, then we ran out of toilet paper there. These things are all connected. And so we have to think about and understand the root causes of that so we can begin to unwind that horrible knot that we have there and begin cutting pieces of it. And I see someone's asking for Marxism classes. Yeah, you should have any kind of classes. As a Marxist, I'm happy always when people are interested in that. But again, it is so much information, and it means coming together and really trying to first have an understanding of what you're supposed to be learning about in healthcare. That means you have to know a little Marxism too, I think. But still, start where you are and start organizing on the issues that you care about and that touch you. Let's see what else is going on here in the chat.
Em, I don't think there's any other questions. So if you want to talk and unmute yourself, feel free to.
Thanks. Hi, I'm faculty at USC Nursing. I think I'm the only faculty member in the audience here. So my question is, oh good, there's more, excellent. My question is, when we who are faculty are well versed in what is structural violence and what is whiteness and how that's already just sort of woven into what our curricula are. And we're trying to get rid of that or help the other faculty understand that this is stuff that exists, and that when we teach our students in the ways that we've been teaching with biological racism and gender essentialism, and that instead of focusing on health disparities, that we should focus on dismantling the institutions and structures that are causing those disparities. And the reaction from peers is basically white shame, I guess, but also violence that's attached to that in the ways that and I'm white, in the ways that white folk do violence. I'm also disabled and trans, and that's been some of the violence I've been getting. Do either of you have any suggestions on what to do?
I think there are, and Em, good to hear your voice. I think one of the things that comes in those spaces where people are trying to shame themselves out of taking the situation into account is really putting forward these examples of people who are living differently, right? And talking about the ways in which they should reconsider some of the things that they're doing. I think these practices of demonstration are really important in terms of what we can do, because I come from a school of thought that isn't as popular, right? Because I'm not concerned about converting them, right? I'm really not concerned about them getting to see my point, right? What I'm really most concerned about is saying there's something else here. Now, we can choose to ignore it, or we can actually go into something that actually allows to shift our practice that are aligned with what students say they actually want to see and want to hear more of. And I think that intentionality becomes important, right? So there's a couple of things happening. One, you're building community with the folks who understand what it is that you're talking about. And then at the same time, in your practices of demonstration, you are now living the ways in which demonstrate something different to folks. And I think this, we can really exude this in our classroom spaces. And then when folks start to hear about what happens in our classroom space, then that same group of folks who have been violent towards you in many ways, some ways unbeknownst to even them, will begin to ask you, oh, wow, what are you doing in your classes? Now, you have the discernment on whether or not to share that information with them or tell them, look, you know, this may not be for you, right? But I think that, and not to exclude them, but to say, look, if you're going to do this, there's a certain set of issues and concerns that you have to address and a certain set of commitments that you have to engage. And I think that honest conversation with folks lets, one, them know that where you're coming from, and then two, it allows you to concentrate on the projects of demonstration that allow you to think, talk, and act differently, right? And I think that's often difficult in places like the university that are so hostile and violent to people who have been deemed other or disposable, right? So I think that those, when I hear your question, those are the things that I think about in terms of what we can do in real time on the ground.
I would agree with that. And I would first, let me just say that there is no more horrible space, in my personal opinion, than academia. I am so glad I was not a full-time academic and practiced. So let me just say that in the beginning. So my hat's off to colleagues that where that's their primary workspace. But to come back to what David was saying, I think there are some things even at the graduates, at the collegiate and graduate level, that are cultural practices that are a problem, and especially in healthcare where we're so hierarchical, so that faculty are often embarrassed or ashamed to present themselves in a setting where they are not the expert. So, you know, you see me and David aren't hesitant. We're not, neither one of us are economists or historians. We talk, you know, about what we think all the time. So that's one thing to help faculty understand, is that they're not expert in half the stuff they think they're expert in anyway. And so being willing to be vulnerable to your colleagues and to people that you're theoretically teaching is an important sort of willingness to be critical and to think. That's the first thing. The second thing that I think, and I'm going to say this, people can disagree if they want. I think that we commit malpractice in the health field in terms of how we teach our disciplines. And I think it's a crime, so that we do not teach, and therefore we do not discuss enough with our colleagues the questions and debates that we have. They're like hidden. They're hidden debates. I'll give you one example. It's a recent example. When our younger students in public health brought a resolution that said that police violence was a public health hazard. They brought it to our largest organization, American Public Health Association. The first 2 years they brought it, the senior faculty-based people said you don't have enough peer-reviewed literature, even though the peer literature didn't have any information on this. We said a bunch of stuff that was wrong. So I would say, and I say to my faculty colleagues all the time, not only do we not teach what we should be teaching, and we don't say these are the questions we're fighting about. We don't even want to admit that they're questions that we're fighting about and arguing about. That means you're not willing to engage in real critical thinking and discourse. And so then you can't have a curriculum that makes any sense if you're whether you consciously understand it or not, if you're only there to teach a basic line. So even though I have my opinions on many things, the real question is how raise it in a critical way so that our colleagues can grasp these questions. I wish there were easy answers to all this. They're not easy answers, but the way we teach how diseases come about at only the biomedical molecular level, that's an important level, but we know, everybody knows that's not the only way. It may not even be the most important way. So for those of you that are younger than me, because I don't, I'm in retirement, so I can just ignore the people. But those of you that are younger, and more importantly, those of you that are real academicians and are working in the space, it means really understanding your science and your area, and it means being willing to challenge within the language of that science. And fortunately, in every field that I'm aware of, there are people struggling for a different framework and raising different questions and speaking from a different value system. So it means connecting up with those people. I think the evidence in the world and science in general is on our side. And so I don't worry about it so much, but it means being willing to really take those critical questions, look at how we do research, whether, how much research have we done on racism? Not very much. We always just use race as an identifier, but there's no reason why that as scholars that we shouldn't be asking ourselves, how can we begin to look at the impact of racism on health outcomes? It means different measurement techniques. We've had these problems before. So I would encourage you to hang in there. There are people, as you know, I'm sure, that agree with you. It means working together to find a critical discourse to have those internal fights in the academic spaces. You're saying the faculty refuse? Yes, the faculty always refuse to do that. They always have. They did it when I was a student many decades ago. But now you're there, and I know some other faculty there, and at least I don't know if they're still there in the nursing school that could name racism. But fortunately, the students keep naming it. It's not racism is real. It's not going to go away. So as people do research, as they get published in this area, then the conversation will shift even in the School of Nursing. And so you're right. None of them have. The faculty is old, young people. So things like critical race theory, half of them never heard of. So again, it's really a question of pushing the discussion and debates. This happens in every field. We happen to be concerned about these critical social issues, but it happens in every academic field, whether they're talking about what makes up a black hole or what, half the stuff I learned in medical school, it's not even thought of today. No one even mentions it. They no longer teach it. So every arena of human activity is an area of struggle, and academia is no different. And so that's why what the students are doing in these kind of settings becomes so critical. So one thing faculty can do that want to talk about racism and critical race theory and other important concepts is to work with students that are interested in learning that and developing the curriculum, etc. I think that together we can push our accrediting bodies and people that keep track of what we teach healthcare workers. We can begin to push them in the right direction. But it's a struggle. It's going to be a struggle. Effective ways. Yes. So one thing, so somebody's asking about effective ways for students to teach the teachers. So one thing the students can do, so this semester, for the first time, the School of Public Health has a 2-hour course, not the way I would have set it up, on racism. They've been asking for this course for 8 years. Some of the faculty, but I'm just adjunct faculty. Some of the adjunct faculty have been saying, yeah, we need courses on racism. So just this year, just this summer, they called a couple of us up and said, okay, we want you to do a course on racism. So that's only because the students pushed and pushed and pushed, and the students had extra seminars and extra classes and extra discussion areas. So there is a way you can help the faculty. Keep insisting on what you want. And when you find faculty that are willing to engage in a collaborative learning space with you, then you can together explore issues, bring in speakers, have seminars. That's always it. teaching is always a two-way street. When I teach a class, I always learn more, far more than when I teach, than what I teach. And so I think there's enough community, especially nowadays, that exchange interaction can go on. Don't back down. So
Can I do one follow-up question?
yeah, you can do anything you want.
Thanks. Do either of you have suggestions for how to take care of yourself when the environment is so bad that for the last 10 days, I've been trying to convince myself not to quit every single day, and thinking that if I did quit and started sex work, that would be safer. I've just been having trouble finding any other jobs. My dean, in front of witnesses, told me how she is colluding with my department head and Access and Equity and Faculty Affairs to, she just sort of laid out how they were planning on discriminating against me because of disability, said some transphobic slurs. How they work together to like not address me being, it's like there's so much violence. There's like even more that, like, saying it out loud here should have content warnings, I guess. Like,
Yeah, I think, and thank you again, and for sharing that, because I think it's important to recognize the real trauma and terror in those situations. I think there are a couple of things. There's one is the legal route, and to really understand, to Doc Murray's point, you are not helpless in this, right? There are avenues for you that you can actually utilize. Now, there's another thing in this, and I think this is important. One of the things that people often talk about is limiting your time with the purveyors of violence, right? And in higher ed, one of the things that you have to do sometimes is limit your space with them, right? Because if they are operating in ways that are that hostile and violent, then there's no good reason for you to be in spaces that exude that type of violence, right? It's even longitudinally is hazardous to our health, right? So now I think one of the spaces that you can do is really kind of map out who are the folks that have demonstrated their allyship to you. Now, note I say demonstrated. They have not just talked your ear off. These are people who have literally and physically said, okay, if this happens, then here are the things that you can do. Here are the ways in which I can support you in this practice. And those are the people that you gravitate towards. I would say right now, one of the things, the most important things to do is limit your time with anyone like those folks who have demonstrated that type of violence. Second, to review and see what are the available resources that you can utilize to activate a space where you do not have to engage that. But at the same time, I think the most important thing around self-care and self-care as a revolutionary act is that you be able to find those folks and build community with those folks who have demonstrated how they will support you. Because right now, that hostility and violence is proving to be more hazardous than it is beneficial. And right now, my concern is about your well-being over any department machination right? So this thing around prioritizing your well-being in that space and then figuring out what the next steps will be, but prioritizing your well-being first.
Absolutely. And let me just, I don't think I've met you. If it is, it's very brief. Um, you know, let me say one thing first. Your assessment of the situation might be correct. That is to say, it might be better for you to quit. I hope it's not correct. So I don't want you to quit right now. But what I'm saying is, after you've done what Dr. Stovall talked about, after you've sought out allies and you've been very thoughtful, there are some times where you may have to actually quit a job or leave a space to preserve your sanity. But what I tell people is always ask, when you leave that space, the reasons they're discriminating against you are existing in other spaces too. So think about that. And from just listening to you in this little brief interchange, we need people like you in the School of Nursing, not only in any school of nursing, but especially in the UIC School of Nursing. So I hope that your insight and skills aren't lost to the field. But you shouldn't feel guilty if you come to a reasoned notion that you have to quit. But this same argument and struggle will exist in any other place you go also. And so whatever you do, you have to find allies, legal structures that may be able to help you, and allies and safe people that can give you support. They may not be academics, and they may not be, especially in the School of Nursing, but I know that they're out there in general in the world, and so that often helps. For me personally, everybody's different. For me personally, I'm always in a better place when I'm engaged in fighting back against those people. Some people would say I do that too much, but in any case, that helps me personally. Everyone is different. So definitely do some self-care, talk to some people that understand you, that you can open up with, and then with their support, you can thoughtfully map out what you're going to do. Okay, so those I'm looking at in the chat. So those will come up again. So again, this is, and I will say this. That's why Malcolm's slide in the very beginning said thinking is dangerous. So when you put information out there that you believe in, that you think is important, you often will get retaliated against. Much of the time, you won't even know. You won't be able to prove what they're doing. So be prepared for that. Have some understanding of what's going on and what the norms are and how likely you are to be attacked, in what manner and shape. But that doesn't mean you have to give up the fight. But you can't fight if you can't take care of yourself. That's critical. So that's not a contradiction. Taking care of yourself, in my mind, is tied to one's ability to engage in struggle.
Yep, at all levels.
Yep.
And Maxwell, in terms of transformative justice and what it means to me personally, transformative justice is living in recognition that some harm has been committed, and then working in community to address that harm, but also improving the conditions where that harm took place, right? So it's not just saying, well, a person has been harmed, let's tend to the person. It's a person has been harmed, let's tend to the person, and let's understand why we're in this situation and what we can do collectively to address not only the situation so that fewer people or no one else is harmed in a similar way, right? And I think that to me is what indigenous communities teach us about transformative justice. And, folks who have stolen that without recognition of indigenous communities, I appreciate the land acknowledgement in the beginning, because indigenous communities have not been given credit for actually providing that framework to the world in terms of looking at the harm that has been committed, and then not necessarily what is closure or retribution, but literally what is considered healing for all of us. So,
and I think M has brought up some important things that I want to just throw out for you all to think about. you all are in what I call, those of you that are in healthcare, you're in a very peculiar cultural structure. It's almost like we have medieval crafts. You know, we have nursing and PAs and physicians and pharmacists and dentists, and we all have our own little secret, handshake and stuff like that. And it's very hierarchical. You have a charge nurse, you do what the charge nurse says. If you're a junior resident, you do what the senior resident says. And so it becomes important as you go through this process of acculturation, of molding you to become the professional that we want you to be in the future. It's really a task to have a subversive attitude toward that, to have a subversive understanding of what that means. Some of our structures are so racist and so hierarchical that for me as a medical student, that was easy because I was clear. They didn't really think of me as a doctor and never would. So I wasn't torn. I mean, I knew up front, that they didn't like that. But the point is, if you don't want to become your professor or your attending or the person you see on the floor, if you want to function in a different way, if you want to be, in fact, an anti-racist health provider, if you want to be involved with social movements for social justice, then what you're doing now when you're students becomes critically important. And what alliances you make now and how far you reach out. I was glad to see some people here, not from Chicago, on this call. So every city, every locale, every school has its own different structure. And I would just encourage all of you to try to do what you can to keep yourself healthy and do what you can to become an excellent professional or whatever that means, because only when you're an excellent professional can you really act as a good saboteur and undermine the entire structure. So every Black man that successfully becomes a physician and functions well and is involved in their community, that's like a blow against that white supremacist male hierarchy. And so just have that in mind and understand the very fact that you have this kind of meeting on a weekday evening is part of that process of building an underground movement, if you will, if you want to call it that, of health people who are dedicated to really being healthy and having a healthy world. So there are people that are in their 80s that have done this for their whole career, and I'm always happy to see younger professional students coming along also. So we just have to speak up with more urgency, certainly than my generation did, and we have to speak up in a more collective voice, because we don't have the kinds of time that we had 40 years ago. We really have to speak up loudly and quickly, because we see people in our communities dying in front of us, and it's not just the Black community or the Latinx community or the Korean community that sees these excess deaths. Now we've gotten to the point where America has pneumonia. So I'm not saying, we don't have to have questions. People could make statements. They could, I don't know if they can unmute themselves but somebody can unmute them. So Em is talking about no grades, no testing, follow-up discussions about processor. You know what? This is why the school does. Now I see why they're messing with you. So, but I agree with all of those goals. We should talk offline. I have some suggestions. We could talk later about that.
Can you, I think M's point was actually what I was going to bring up in a question. Can you both talk about like teaching pedagogy, like how you choose to teach and how that might look different from other folks, your colleagues, how they may teach, and how you center and hold all your values in the way that you teach others? I think that could be a really important thing for folks to learn.
Yeah, I think one of the things that comes up when we talk about learning and pedagogy, or the practice of our teaching, one of the things that I kind of hang my hat on is there has been something kept from us, right? In many ways, stolen from us, right? And now, what paths do we engage to get that thing, to recoup that thing that was stolen from us, right? One, knowledge of ourselves. Two, knowledge of our conditions. Three, knowledge on how to change those conditions, right? So I center my approach in that, right? So I get those questions around who has been excluded, what's been a rationale for their exclusion. And now when I start to engage those points, I try to push it out to say, okay, so what does this mean in the here and now? And now what do we see? How do we see ourselves connected to this or not connected to these things? And I think when we talk about anything around teaching from a critical perspective, this idea of uplifting the question in opposed to just focusing on the content, right? Because I think when we can uplift the questions, now we can get into a number of ways that people have addressed them. And we can also get into potentially a deeper unknown, right? So I think those things around being able to lift that up, but starting from the premise that something has been stolen. Now, what are we willing to do to recoup it?
Yeah, see, Dr. Stovall's an educator. I don't know if I could describe all that stuff. But what I try to do is ask questions, and I prefer, small group discussions or a small seminar approach. But that's not the only thing. I find this kind of stuff very frustrating because I can't see your body language. I don't know what the hell people are thinking. I can't call on anybody. But I will say this. To me, asking the questions are the most important thing. And if I find myself in a setting, which I often do, where the class has a set of values that are close to mine, I try to question them about that. Why do you think that that's the most important way to think about this problem? So really being able to ask the critical questions is more important than the actual content of whatever you're talking about, and understanding the historical development of those questions over time, to me, are the most important things. And that's what I try to do in my own thinking. So for example, when Reagan won as president, some of y'all weren't alive then. Anyway, when Reagan became president, I said, I need to understand the history of the right-wing movement, because I had never read that. I mean, I had read history of oppressed people, but I hadn't read that history. When Trump won in 2016, I said, I need to reread 2 books, which I've done. I reread Black Reconstruction by Du Bois, and I reread The History of White People by Nell Painter. So that's my approach when I have a big problem. I say, what the hell is going on here? And I try to find some historical understanding of how those arguments and questions come up. So like, I don't know what's going on with white people when they elect Trump, actually. I need to go back to basics and try to understand where this is coming from. So I think that approach, certainly as a clinician, as a physician, but I think this is true for anybody in a profession, you should always be questioning what you're doing and how you're doing it, and why your patients aren't getting well, or why, that's, you have to have a self-critical eye and a critical eye on your field.
And Chinenye, this piece around a true anti-racist curriculum and how that can be incorporated into a professional school. I know that people are discussing it now, but how feasible it is. Like, well, what I think that's important, and here, I don't know if you're here in Chicago or elsewhere, there's a grouping of people here in Chicago who refer to themselves as radical public health, and then here at the Chicago Health Collaborative for Black Lives, like, these are spaces that I think allow for you to see the capacity of what anti-racist curriculum would be. Because, Ibram Kennedy he's a fine researcher, but his understanding of power in that anti-racism is problematic to me. And I'll say this for a number of reasons, because he talks about everyone being a racist, and that's a problem, right? And I think when you dismiss racism from power, then you allow the oppressor to be off the hook, right? And you don't identify. So it's not that we all participate in it, it's that some people participate in it knowingly, some participate in it unknowingly, and there are a host of victims. And that's not in his analysis in terms of anti-racism, right? But there are other folks who talk about anti-racism, like Kevin Kumashiro, Tracy Orr, who say, well, look, racism means a recognition of white supremacy. And white supremacy has often operated as the perceived views and values of white, Western European descended, able-bodied, cisgendered, heterosexual Christian males as normal, right, and good. And I think when we don't have that analysis, we now say, well, everyone can be a racist. That's problematic, right? And I think when we talk about anything that actually addresses living in recognition of white supremacy, we have to now talk about what Doc Murray just mentioned in terms of these areas of human life and activity that are also areas of struggle. And we also have to think about what has been the rationale placed on particular people, and then what has been the outcome of those rationales, right? So when we look at the mortality rates of Black women in childbirth, when we look at forced sterilizations, when we look at big pharma and its use of particular pills and the side effects of those pills then becoming the usage for that particular medication. So, I mean, I think around these things, again, what type of curriculum supports question asking, and then what type of curriculum is willing to unearth what we know but try to hide. And I think that's those to me would be the building blocks for a justice-centered anti-racist curriculum.
And I think we should be careful about our semantics here. So when people say they want an anti-racist curriculum, I'm assuming, because we don't have an anti-racist culture, so I'm assuming they're talking about they want a curriculum that will help them dismantle white supremacy and racism, and for me, capitalism. So the first step in that is understanding it. That's the first step. So I have trouble with people who say they want to be against market systems and they don't understand how market works, or they want to they want to be anti-racist, but they don't understand how racism operates in all of its myriad forms over time, because you can't dismantle it if you don't understand what makes it run and how it works. So I would argue that the biggest change in the curriculum is probably, again, not so much in content, but in perspective of how you think about the development of American medicine and how you can change it. We don't teach in our medical schools the history of medicine. So I don't know nothing about how we don't even teach. Why do we have a system that's so different than England, or different than Germany, or different than France? So the thing I would say is, first, you got to understand how we got where we are. You have to understand racism at its deepest roots. You have to understand how it's manifested against Mexicans, how it's manifested against Chinese. You have to understand all of that if you're going to dismantle white supremacy. And that, to me, is the real anti-racist educational goal, learning objective, if you will. How do we dismantle this motherfucker? Which means, how do we dismantle racial capitalism? How do we do that?
I think we should take this time. It's just to be respectful of everyone's time. If folks want to stay after, they can definitely do so, as long as Dr. Murray and Dr. Stovall also have time. But we'll just talk about a couple of things before closing, and then everyone, to be respectful of your time, it is almost 8. Feel free to leave as you need to. So if we can go to the next slides. So this is part of a series, as you've all seen. Coming up next is we're going to talk about the origins of the police and how that is intimately tied with slavery. And we're going to talk about mass incarceration. And then we're also going to talk about organizing for prison abolition and what that can look like. Again, with any of these sessions, this is a starting point. This is for you to start having that conversation and look. It is not the be all end all for your own education slash understanding of these issues. And last slide before we go. Feel free to RSVP to our future sessions coming up. One was the one that I just mentioned on the last slide. And then next week, we're also going to be talking about imperialism, homo nationalism, and migration, very intimately connected to the news that we've seen just in the past couple of days. So if you are interested, please RSVP, and please fill out the feedback form for this session as well. You'll get all of this information in an email since you all RSVP'd. So thank you. And I'm going to cut the recording right here.